Vaccine advocacy isn't just about promoting access and policy changes. It's also about engaging in thoughtful, respectful conversations with people who may be hesitant about getting vaccinated. Whether it's a friend, family member, someone in your community, or the legislator you're talking to, it's important to approach these conversations with empathy, facts, and an open mind. Let's walk through some tips on how to address vaccine misinformation and talk to someone who may be hesitant about vaccines. Number 1, listen first. It may be difficult to listen if you hear someone repeating claims about vaccines that you know to be false. But if you immediately shut down their concerns, they may not listen to you in return. Ask open-ended questions like, what are your concerns about vaccines? Or can you tell me what you've heard? Number 2, be empathetic, not confrontational. Empathy is key. Instead of jumping in with facts and corrections, acknowledge their feelings. Use I statements, which help you effectively voice your concerns, rather than you statements, which may come off as attacking or blaming. Number 3, calmly but firmly explain your situation as someone with chronic illness. You're likely used to explaining your chronic illness and how it impacts your life, so you can go into these conversations knowing that you've done this clearly, firmly, and successfully before. Calmly explain your point of view and why it's important for you to get vaccinated and why you hope others will have easy access to, for your own protection as well as theirs. Number 4, use reliable, clear information. It's important to use facts from trustworthy sources like the Centers for Disease Control and Prevention, the CDC, or the World Health Organization, the WHO. Keep the information simple and relatable. For example, you could say, the vaccines have gone through rigorous testing to make sure they're safe, and millions of people have been safely vaccinated. Many people are hesitant because they've heard myths or misinformation. Let's go over some common myths and how you can address them. Myth 1. Vaccines aren't safe because they were developed too quickly. The fact: the COVID-19 vaccines, for example, were developed quickly, but no safety steps were skipped. They used years of research on similar viruses and went through the same rigorous trials that all vaccines go through. Myth 2. Vaccines can give you the disease they're meant to prevent. Fact: vaccines help your immune system recognize and fight the virus if you're exposed to it. Myth 3. I'm young and healthy, so I don't need vaccines. Fact: even if you're healthy, getting vaccinated protects others who might be more vulnerable, like the elderly or people with chronic illnesses. Plus, young people who are healthy can still get seriously ill from vaccine-preventable diseases. And finally, knowing when to step back is important. Sometimes the person may not change their mind, and that's okay. It's important not to pressure or push too hard. You can say something like, I understand where you're coming from. If you ever want to talk more or have other questions, I'm here.